4 patients, 1 surgeon in 1 year. And one of the patients didn't make it home. And y'all, the state knew before the 4th one even happened. Today's video is about the plastic surgeon in Houston who is now facing 4 malpractice lawsuits in 12 months. 1 patient is dead, 1 patient has a brain injury, and both families are asking the same question. How can the system allow this to happen 4 times? As a nurse, I'm going to walk you through what each of these lawsuits allege, why a 10-hour surgery should be a red flag, and how you can protect yourself before you even book a surgery. So I want to talk about ABC13 Houston's news report regarding this story. 4 lawsuits were filed against this surgeon between August of last year and August of this year, so the previous 12 months. According to ABC13 News, one of the patients underwent a 10-hour long surgery and another patient suffered a brain injury. The other 2 allege serious injuries following cosmetic surgery. Now, with that being said, these are lawsuits. They are allegations. I did do a video regarding the patient who passed away. Her name was Joy Barbera, and she underwent 6 different plastic surgeries within a 10-hour window, and she lost her life. So I have some notes here regarding some facts of the case, and so again, these are allegations, y'all, but nothing has been proven as this is still an ongoing court trial. But what's getting people's attention, and it got mine too, is that the Texas Medical Board took action on August the 21st. And this wasn't the first time that this surgeon was sanctioned. He had been sanctioned before, and this time the board ordered him to pay a $4,000 fine. They ordered him to have additional education requirements after reviewing a 10-hour procedure, and that's the one with Joy Barbera, where the patient later died from what was reported as a pulmonary fat embolism. It could have also been from hemorrhaging. I think originally the cause of death was stated as being hemorrhagic shock, which is believable considering that she bled for 10 hours in a surgical center, and that particular surgical center did not have the capabilities of giving her a blood transfusion. And once she began declining to the point that they just didn't know what else to do, I guess, they transferred her eventually to a hospital where she did later pass away. Okay, so let me explain liposuction, because I know a lot of people think that this is just a quick procedure, and it's not. So liposuction, especially the Lipo 360, is where they go and they take fat from around the entire torso. And it is not a quick surgery. It takes hours. You're under anesthesia for hours. You're losing fluids. And when a procedure stretches out to 10 hours, y'all, you're at risk for losing fluids. You're at risk for a blood clot. You're at risk for bleeding out or having a stroke. And the most serious risk that they allege here is a pulmonary fat embolism. It's where little pieces of fat get caught in the bloodstream and it travels to the lungs, blocking blood flow. It's like a clogged pipe, but in your lungs. And it can be fatal very quickly, especially if it travels to your brain. That's why most board-certified plastic surgeons will not do a massive 10-hour-long surgery in a surgical center. They will do it in stages or say that you're not a candidate to have all of that done at once. Or they can also require you to have it done in a hospital, which in my opinion is the safest place to have it done anyway. When a surgeon says yes to doing all of that at once and other surgeons have told you no, that should be a big red flag. So this is where the hospital mistakes and patient safety comes in. I talk about this stuff on my channel all the time. How do you get 4 lawsuits in 1 year? So the board had already sanctioned him once, and then you have all of these cases starting to pile up. One in 2024, and then more in 2025. And the next family says they didn't know about the others when they booked. So in Texas, you can actually look this up. Every surgeon has a profile on the Texas Medical Board website. Disciplinary actions, medical lawsuits, malpractice, hospital privileges, all of that is public information. But y'all, most patients don't know how to look for this information. They simply scroll TikTok and look at before and after pictures and all the comments about how great the surgeon was to, that particular person. But they never look at credentials. Are they a board certified plastic surgeon? They don't look at, has this physician been sued before for medical malpractice? Those are some important things that you need to know before you let a surgeon cut on your body. With that being said, surgical centers credential surgeons too, and they decide who gets to operate there. So with a 10-hour case with a death, a 10-hour case with a death should trigger a peer review and an investigation. Families are now asking, did that happen fast enough? My response to that question is no. If this kind of RN breakdown is helpful, where I explain what the headlines don't, do me a favor and go ahead and subscribe to the channel and like this video so that my channel and my video can get pushed out to other people. It will help other families know what to research when they're looking for a doctor. So with all of that being said, here is Casey's take. I am 57 years old, and since starting this channel, I just get sick and tired of seeing so many families suffer because they didn't do the research, they didn't know what questions to ask, and the news headlines don't tell you that. There are some things that you can do beforehand to ensure your own safety and to be your own advocate. Number 1, ask, are you certified in plastic surgery? And do you have privileges to do these same procedures in a hospital? Because if a hospital won't let them do it there, ask why. Question number 2, ask them how long the surgery will be and if they will be doing it all at one time. If their response is 8 to 10 hours, get a second opinion. That is a red flag, and that is not normal. Number 3, ask them to see their medical board profile. They can pull it up on their phone, or you can pull it up on your phone and look for any medical malpractice lawsuits. And number 4, ask them what is their plan if you have an embolism or another kind of emergency. What is their plan for that? Ask who the surgeon is going to be. Ask who the anesthesiologist is going to be and how long they have worked together. And y'all, trust your gut. If they won't answer your questions, or if they tell you they can do a bunch of procedures at once, that's a red flag. Especially when other surgeons have said no and this one is willing to tell you yes. Let me know down in the comments, have you or a family member ever felt rushed into getting a surgery that you weren't sure that you needed? So to bring this all back home, the Houston case is still unfolding and the 4 lawsuits are still moving through the courts. I will put all of the sources down below so that you can check them out for yourself. I'm really trying to get this channel pushed out so that more people can get this information. Make sure that you like the videos that you watch by hitting the thumbs up button, and I will see you guys on the next one. Bye, y'all.